Hey, deserving listeners, I get a lot of emails from agents asking me to have authors and other prominent figures on the podcast, and I will skim them and will say, I don't know, that doesn't really look that interesting to me. But I got an email from an agent saying that there's an individual named Dr. Lane who wrote a book about how psychotherapy, how therapy, and how brain science is the way I'd put it, come together. And I'm often thinking along those lines, but I'm not an expert in that. And so I thought I would double dip this experience by sharing you this interview, but I'm also personally interested in learning from Dr. Lane. Welcome to the podcast, Dr. Lane.
Thank you so much. Delighted to be here with you.
So you wrote a book. Tell us the name of this book.
The book is titled Neuroscience of Enduring Change, Implications for Psychotherapy. I am actually a senior editor with Lynn Nadell. So it's an edited book with, I believe, 16 chapters, and I've wrote and co-wrote a few of the chapters, but very involved in the entire process.
Interesting.
Yeah.
It's about neuroscience and therapy. And
Yes.
what's the main bullet points that you could share?
Well, the main bullet point I would say is that psychotherapy started over a century ago with Freud, and Freud had the dream that someday we would understand the mind based on neuroscience. In the 20th century, neuroscience wasn't developed enough to really meaningfully inform how we did psychotherapy, but things have changed now, and I think that we can, base how we do psychotherapy, at least in part, on growing understanding of neuroscience. And so I think that we have the opportunity to potentially be more effective as clinicians and have more enduring results as a consequence of this newer understanding.
And for the therapists out there listening, what could you share with them in terms of the science that would help them with their clients?
There are over 500 different kinds of psychotherapy, and there are all these different theories, but there's been an effort to really think about what the foundational fundamentals are of psychotherapy and how it works. We have a much improved and advanced understanding of memory and different kinds of memory processes and how they interact with emotion. I think that fundamentally, psychotherapy involves a kind of learning process, and there are basically three ways of altering memory for clinical purposes. So one way, which is highlighted in our book, is called memory reconsolidation, which means taking old memories that are problematic, right, and changing them, changing the memories. Memories can be updated and modified, and so that they don't revert back. So that's mechanism number one. A second important mechanism is extinction or suppression of problematic learning. And that does have benefits, but the benefits may not be as enduring because the old learning is still there. It's just that the old learning has been suppressed through inhibitory mechanisms. And then there's a third type of learning, which is new learning that competes with the old learning. And over time, as you practice it, it takes over. So I found it very clarifying to think of it that way, and also to realize that emotion plays a really, really important role in all of this, because we can't remember everything, but we need to remember what's important. And emotion is a natural mechanism for identifying what's important.
Yeah, and colors the way we perceive and remember things. So let me just bounce off my conceptualization of therapy, and then I think I know where it fits into those three aspects of memory, but you tell me. So I'm an integrative therapist. I love theory, and I incorporate all the major theories in my approach and when I teach my students. And I have boiled everything down to two pillars of therapy. One is self-awareness, and two is what I'm calling corrective experiences, which is an idea from psychoanalytic or psychodynamic therapy. But it could be, you could totally phrase it differently, like learning or something. And with self-awareness, in terms of what you're saying, it's in terms of learning, you can learn, oh, I have an impulse to, and when I have a bad day at work and I'm upset about something, I have an impulse to go to a negative place in my head. I have an impulse to drink myself, to numb out at night. I have an impulse to withdraw from people. But I've learned through self-awareness that actually doesn't work for me. And so I am going to do something different. And then,
yes.
So that's self-awareness, in a nutshell. And then corrective experience is, for example, someone grew up with a lot of abandonment growing up, and they learned that humans, particularly close to them, are going to abandon them, and that they are abandonable. They can't trust other people. People are going to hurt them. Human closeness equates to a lot of pain, a lot of fear. But through the corrective experience with me as a therapist, the client could learn that they can trust someone, that I'm not going to abandon them. I'm not going to leave them. I'm not going to judge them. I'm not going to hurt them. I'm going to listen to them. I'm going to accept them. And through that experience, and hopefully other relationships that we can build outside of the therapy office, they can have a corrective experience showing them that they can trust other people. And that that cascades into all sorts of other things, like that they are more relaxed around other people, that they stop misinterpreting other people's signals as signs of abandonment and other kinds of. So how does that fit into those three different memory aspects?
Oh, beautifully. I should say that you and I see things very much alike. I have devoted a lot of my career to something that I call levels of emotional awareness. That is exactly what you're talking about with regard to the first part, self-awareness. The book, I would say, focuses more on the second part. A little background. We published a paper in a leading neuroscience journal in 2015 on the basic theory of change. Okay. The theory capitalized on a couple of major advances in neuroscience. One is the discovery, the proof that was widely accepted for the first time in the year 2000, that memories are not fixed, but that memories are modifiable. Okay. And we call that memory reconsolidation. Memory consolidation is when you go from short-term memory to long-term memory, and it gets fixed for a while. But then the discovery was that whenever you recall a memory, it goes into what's called a labile state and can be updated based on new information that comes in when the memory is in the labile state. And then that memory gets coalesced in a new way, and we call that memory reconsolidation. Okay. So a second aspect of our theory is that based on work done here at the University of Arizona by Lee Ryan and Lynn Nadell and others, we've really come to appreciate that two categories of memory that we thought were very separate, episodic memory and semantic memory, are actually highly closely related. So episodic memory is an event memory, such as my experience of talking with all of you today. Okay?
Right.
Semantic memory is more generalizable knowledge, right? It can include facts, who's the president and what's the capital of this state or that. But it also can include more complex kinds of phenomena like schemas, right? Like relationship patterns. As an example, if you go to a restaurant, you have a certain set of expectations about what happens, right? And similarly, you mentioned traumatic experience, right? You grow up in your family, you develop expectations about what happens in relationships, what you can do, what you can't do, how people respond. And there's a big difference between growing up in a healthy household and growing up in a traumatic household. And we think of that as a kind of semantic memory or schematic memory. And that, we think, is a type of memory that can be modified as well. Okay, now the thing about memory is that naturally we think of it as creating a record of the past. And indeed it does do that, but why do we have that? We need to know what happened in the past to guide future behavior. And now our understanding of how the brain works in terms of making predictions all the time and using sensory information to update those predictions. Those old memories aren't old memories. They're active in the moment, guiding our behavior. Okay. So in this paper in 2015, we said that there are three major steps in creating enduring change. One is that you have to activate the old memory and the associated painful feeling associated with it. Okay. And that memory could be episodic, it could be schematic, right? Step two is corrective emotional experience, the introduction of new emotional information that is contrary to your expectations. So let's say something happened in the past and you are very ashamed of it, you never told anyone, but you're in therapy and you share something that's actually you feel quite ashamed about, and you really expect to be ridiculed and chastised and rejected. And lo and behold, your therapist provides a corrective experience of being caring, compassionate, non-judgmental, accepting, etc. That difference between what you expect and then what happens is a prediction error. And we think that's a principal mechanism of updating memories. And then the third step is practicing new ways of construing and responding to social situations in the outside world and having the new kind of experience, right? So, for example, if you've been mistreated and you conclude that, people aren't worth it and you withdraw socially, you're missing out on opportunities to update those memories. But having had the experience with the therapist, you then might have the idea, well, it might be possible for me to have better experiences, so I'm going to try this. And then you go out and you interact, and lo and behold, it's better. And so you are updating the schematic memory. Okay. I think what you're talking about, by the way, you said you're integrative and clearly, psychodynamic is a part of it. And that's how I would describe myself. Obviously, there are a number of other well-validated methods of therapy that use these other memory mechanisms as well.
Yeah, behavioral. Mm-hmm. You mentioned schematic, schema therapy. I use quite a bit as well. Mm-hmm. Interesting. Yeah. Okay. So it's reconsolidation. Corrective experiences are an opportunity to reconsolidate, and it's important that we, as therapists, create these corrective experiences, but also make sure that the client is actually experiencing them emotionally so that they can be corrective. Because we can be providing the corrective experience, but if the client chooses to see it as a negative, like, well, I know my therapist really doesn't really like me on the inside, and so it doesn't get reconsolidated as a corrective experience, even though you're providing. So you have to almost kind of enter their head a little bit and say, like, well, how are you seeing this right now? That kind of thing.
You're absolutely right. And that's one of the arguments for more frequent therapy, to have more.
Meaning more per week or more over time?
Well, it even could be. I mean, in psychoanalytic circles, they're really talking about that as a justification for having multiple sessions per week, precisely for that reason, because the old memories are so deeply ingrained and it takes a lot to modify them.
Right. And that a few days after the session, they might kind of go back to that way of seeing even their therapist, and that can reconsolidate, it can sort of backtrack in terms of because you're now reconsolidating in the negative direction without guidance from the therapist. That's what they're thinking.
Mm-hmm, mm-hmm.
Interesting.
Yeah, it does take repetition. There's no question about it.
Yeah.
Sometimes, though, and I should also say that there are different kinds of memory experiences. And we make the distinction between implicit and explicit. So it's not unusual, obviously, for people to have relationship difficulties. It's not unusual for people to never have had anyone who they could really trust and confide in, right? Mm-hmm. And so to interact with a therapist on a weekly basis, where the therapist is empathic and trustworthy, and has the person's best interests at heart, it may take a while for the person to kind of recognize what's going on, but they can kind of sense something's a little bit different. And it may take a while to get to the point of being able to say, hey, I really realize that this is different. So I think that the corrective experiences can be incremental and, not, flashbulb experiences, aha experiences of, oh, that was, a lightning bolt, wonderful interpretation, and I just see everything differently. Okay. Now, I think it builds up over time, and maybe by the time they actually can say that something seems different, a lot has gone into it.
Right. And of course, with something like disorganized attachment, fearful attachment, the closer they get, the more afraid of you they become, and the harder it is for them to tolerate being close because they have
That's
learned,
right.
They've consolidated memories of closeness equals abuse.
Yes.
So you mentioned Freud. If Freud were alive today, reading your book, would he say like, "Yeah, I knew it"? What do you think?
As a matter of fact, I think he would, with regard to some key aspects. Believe it or not, Freud was the first person to describe what we would call memory reconsolidation now. He called it memory retranscription. Okay.
Pretty close.
Yeah. In 1896. And he went on to use a concept, German word, Neutroglykeit, to describe a related phenomenon. For example, this involves taking, for example, a childhood memory and revising the nature of the memory by virtue of being older and knowing more. So, for example, there's the issue of, child or sexual abuse in childhood, where children don't really know that much about sexuality. But then, when they grow up, puberty, adolescence, early adulthood, they know a lot more. They can look back on it, and that can change the nature of the memory for the childhood experience. And he called that Neutroglykeit. So, yes, he was the first one, actually.
Interesting.
Yeah.
And side note, did he retract? Because I'm not a super Freud scholar, but I know that he went through a number of phases, and what you're describing as his early phase, in the late 1800s. Had he later rejected or veered away from that perspective?
No, I think that he didn't talk a great deal about memory retranscription, throughout his career.
But it was a big part of his early work.
It was a big part of the early work, no question. I think that, his fundamental decision was that, the first patients that he saw were women who were talking about being sexually abused by their fathers, and presented it and was, roundly criticized by people, said that couldn't possibly be the case. And he changed his view to one of it being related to childhood sexual wishes on the part of the child, as opposed to it actually happening. Okay.
Right.
And so I think that was an important decision. And so it's not that memory is not important, but the recall of memory per se was much less important than identifying fantasies and wishes.
Yeah, and I get the fantasies and wishes, but the emphasis, I think, really set us back in our field for a number of decades. That if you understand what Freud was saying in the beginning, it's totally in line with like cutting edge work that your book is about. This idea of looking at trauma and bad experiences and having corrective experiences around that. Like he was doing that. He was talking about it. He was writing about it, and then started to emphasize this inner world too much that was kind of disconnected from experience. And people went with that throughout the early 20th century in psychoanalysis, and I think that was a big mistake.
I would agree with you. I was trained in psychodynamic psychotherapy in my psychiatry residency in the late 70s and early 80s. And I thought highly of the approach, but an aspect of my career, so fully trained as a physician and psychiatrist, but I also had deep-seated research interests in emotion, actually. emotion as applied to health, emotion as applied to psychiatry and to psychotherapy. And I was fortunate to get a Research Scientist Development Award from the National Institute of Mental Health. Enabled me to get 5 years of training in neuroimaging and emotion research, and I got a PhD in experimental psychology. That really enabled me to, number one, understand the brain, but number two, to appreciate the importance of emotions. And at the end of that training, just coincidentally, I encountered a psychotherapist named Les Greenberg, who's developed what's called emotion-focused psychotherapy. And it's a therapy in the Gestalt tradition. And he has a way of working with emotions that's much more active and intense and alive in the room than a traditional psychodynamic approach. And so I really kind of fell in love with that and have really attempted to integrate, emotion-focused psychotherapy with more psychodynamic approaches. So I, like you, would describe myself as an integrative psychotherapist. I love what you said about, the whole inner world being cut off from experience. And I think that's what the Gestalt tradition brings back, experience. Yeah. And it's corrective emotional experience that I think is especially important.
Yeah, getting back to that. So, as an author myself, when I'm writing, I get real focus. I start seeing everything. I start looking at myself and my relationships and my dogs. It's like, are they having corrective experiences right now? How did this affect you as you were inundated with this knowledge? Did you think, well, I've had some issues in my life that probably could use some corrective experience, some reconsolidation of memory.
Yes.
Maybe I can engineer that for myself.
Oh, yeah. Well, for me, my father was a psychiatrist and psychoanalyst. And so I was exposed to this way of thinking, from day one. And, going to a psychotherapist was a natural thing to do. And I've done that a lot. And when I think back, before I was aware of this perspective, right? When I think back to things that really made a difference for me in psychotherapy that I had, as a patient, it was corrective emotional experiences, things that were just totally surprising to me that were very healing. Mm-hmm. Okay.
Yeah.
So that's one thing. I can also say that now that I, have written about it and practiced it as a psychotherapist myself, I find that it's very instructive, and patients, clients benefit from adjusting therapy to follow these 3 steps. And I'm a professor at the University of Arizona, and I supervise 8 psychiatry residents, and we're all doing psychotherapy. And, once the residents get the hang of it and start doing it, I find that people start improving and benefiting from it,
Yeah. So 2 questions. 1, do you use this language with your clients? And 2, can you tell me the steps again? Because I don't think that really landed with me.
Yeah. Well, I certainly do use the language of memory reconsolidation. I will not necessarily spell out the following 3 steps for them. The 3 steps are, step number 1 is what Freud described in 1895, right? Which is activate the old memory and the painful emotion associated with it. And, now catharsis, we don't think it works by catharsis. I say it works by memory reconsolidation, but getting the emotion activated and experiencing it, in the experiential tradition. I think that's step number 1. Okay. And the idea is that you're then making the problematic memory labile by activating it in that way.
So you can't just remember like, oh, I was abused once. The emotions have to be kind of felt.
I believe so. Yes.
Otherwise, the memory isn't fully engaged.
That's correct. Because I think that, memories are...
And this is Les Greenberg getting in your head.
Mm-hmm. But also a little bit of neuroscience as well, because not that he's, he certainly loves neuroscience as well, but just in terms of thinking about how memories are encoded in the brain, the different systems, like, for example, if you recall an event that has visual information, auditory information, sensory information, cognition, emotion, motor activity, when that memory is activated, all those different systems in the brain are activated, right? And I think that it's important to really activate the emotion in order to identify the emotional locus of that in the brain, right?
So it's not really fully remembered until you remember all the aspects of that memory, including the emotion.
So I have to say that we are extrapolating from basic science research on memory reconsolidation, okay? And so there's no question that there's a whole large field of memory reconsolidation research that has nothing to do with emotion, okay? Like experiments done where you have college students, remember a list of items, right? And then you come back another day and you have them learn another list of items, and you can manipulate the conditions so that if you give people a reminder of the list on day 1, when you learn the list on day 2, items from list 2 will intrude into list 1 because the list 1 was activated and put into a labile state. Okay, that has nothing to do with emotion, all right? But I think when it comes to psychotherapy, I think emotions are very, very important. People remember what happened to them when they were traumatized, but they haven't really formulated the emotions, right? I mean, you just might be overwhelmed. I mean, that's the definition of trauma. You're overwhelmed. But then when you review it and you can start putting the pieces together emotionally, it's very important to be able to update the emotions.
Right.
Okay.
So that's number 1, is to engage the emotion and
experience the emotion.
Experience the emotion.
And then number 2 is to have a vivid corrective emotional experience that's contrary to the painful emotion that you have and the associated expectations.
Okay. So either guided imagery or just experiencing the relationship with the therapist?
Or Les Greenberg would use, Gestalt techniques like a 2-chair dialogue, where you're going kind of back and forth between. It seems hokey, but it works.
Oh no, I do it. Yeah. Yeah. Some of the most powerful of experiences I've ever had as a therapist and as a professor is using chair work. Yeah.
It's very potent.
Yeah. Okay, so that's step 2.
Step 2, and so those 2 are happening, in the psychotherapist's office.
And then 3 is what?
Outside the office, basically, is because step 3 is going out into the outside world, practicing new ways of construing, of understanding situations and responding to them differently.
Mm-hmm.
Okay. And having new experiences that are in line with the corrective emotional experience.
To solidify or to continue to have the corrective experience, kind of a thing?
To solidify. The way I think about it is that when it comes to relationships, we're talking about schematic memories, right?
Yeah.
Those set of expectations about what's going to happen, right? And because of trauma or bad experiences earlier in life, you aren't inclined to try out things that would enable you to get close to people, right? So the advantage and why therapy is necessary is that it introduces new ideas and new options for you that you're willing to try, okay?
Right.
But then you have to try them. And I think a way of understanding it is that you're trying to generalize the applicability and flexibility of this schematic memory.
Right. I mean, the way that I see it, it's like your corrective experience and change neurologically will happen if you only do it in the therapy office, but it'll go a lot faster if you also do it outside of the therapy office.
Mm-hmm. And I think it'll be more robust.
Right.
It'll be faster and also more enduring and more widely applicable.
Right, more generalizable.
Yeah.
How does this all fit into prolonged exposure, imaginal exposure?
Well, that's a great question. And when we're dealing with trauma, obviously exposure therapy is maybe the best validated treatment out there. So this brings in the second mechanism of memory that I was talking about, called extinction. Okay, so goes back to Pavlov's dog, or fear conditioning in rats. So fear conditioning with rats would involve having a rat in a cage. You present a tone and nothing happens. You introduce an electric shock in the floor and the rat jumps. You play the tone when the rat gets shocked, and it has learned that the tone, the conditioned stimulus, is associated with that bad experience. So then when you play the tone by itself after the pairing, after the conditioning, the rat will jump. What we know now is that if you expose that rat to the tone over and over again without pairing it again with the shock, over time the rat will stop jumping. Okay, we call that extinction of conditioned fear. And when you're working with laboratory animals, you can really dig in and examine the molecular and neurological mechanisms. And we now know that the way that works is that the frontal lobe is now sending inhibitory signals to the amygdala, right? That's what extinction is. And the conditioned fear, which has been learned by the amygdala, remains intact, okay? So that creates a vulnerability to relapse, to jump in fear. All right?
Interesting. So this is, I didn't know this. So let me paraphrase what you're saying and make sure I understand what you're saying. So that, for example, with humans, when we are being abused, for example, or abandoned by someone close to us, we associate human closeness and love or attention with abandonment or harm to us. Sorry if I'm sort of jumping ahead in your explanation. And then if we have a corrective experience in therapy where you get close to the therapist and it's shown that you're not going to be harmed by a close relationship, it's the prefrontal cortex inhibiting the amygdala, but the amygdala is still, it remembers, it never forgets that closeness equals pain, but over time, by not experiencing the pain, the prefrontal cortex is saying, it's okay, like, we've learned something new here. I get that you have a trigger, but calm down. At least that's what you're saying?
What I'm saying is that if you meet with a therapist and the therapist is benign and are helpful, you will learn that you don't have to be afraid of that therapist.
But the memory of the encoded...
The old memory will remain intact.
That closeness equals pain.
That closeness equals pain.
Okay.
And a way to... So...
That's like step one.
That's if you have step one of the three-step process of activating the old memories and activating the painful emotion, and then you juxtapose that with a corrective emotional experience while that painful experience is online, then you can have memory reconsolidation.
And that will change the amygdala, the
yes,
triggering.
That is the idea.
So if you get inside the rat's head, you would like pet it with the tone instead of just like not having the electrical shock, right?
Yeah, yes, exactly. I mean, so a way of thinking about this is that extinction involves attenuation of the negative, right? But it doesn't involve an introduction of the positive, whereas corrective emotional experience does.
You might have a lot of people walking around actively attenuating their fear, just like, don't be afraid, but the fear is still there. And that could be, I guess, analogous, not exactly the same as like self-awareness, but the corrective experience actually negates the need to push back and attenuate your fear response.
That's correct. That's exactly right.
Yeah.
And I've recently, I've published a number of papers on emotional awareness and published some papers recently on psychotherapy. Increasing emotional awareness in psychotherapy is kind of a universal goal. And it's very fundamental to change, but it's not enough. In the same way that having a therapeutic alliance is essential, but it's not enough. Promoting emotional awareness is essential, but it's not enough.
Right. Yeah, that's interesting. Well, I'm glad that neuroscience has validated my conclusion along these lines, because I frequently am saying to clients and to my trainees that raising awareness is important, and that's what you can do in the short term, and you should do everything you can, but it's not going to eliminate the feeling. You know, the feeling comes up of like, my partner's abandoning me. Okay, you have to be differentiated, as Bowen would say. You look at it, you evaluate it. Is that rational? But it's not going to take away that overwhelming sense of fear. Your body is still going to feel the fear, but your mind is going to be evaluating that, going, okay, well, I'm not going to go along with that. I'm pretty sure I'm being irrational, but it doesn't take away the fear. But you can do that in the short term. Long term is through corrective experience that actually will take away the fear completely, because you no longer associate closeness with terrible things.
That's right.
Yeah,
exactly.
And so your book advocates for long-term therapy, is what you're kind of saying earlier.
Well, let me tell you about the book. We wanted to elaborate on our 2015 article published in the Fleeting Neuroscience Journal. We felt that we really had something, but yet we had only scratched the surface. It's basically in 3 parts. In part 1, we have 7 or 8 chapters on basic issues, basic aspects of the model, like fundamentals about how emotion works, about how memory works. Separate chapters on memory emotion interactions. Then fascinating work on sleep, because the consolidation and reconsolidation happen during sleep. Then the second section is having 5 expert psychotherapists talk about how memory reconsolidation is relevant to their way of doing therapy, right? And then the third section is some summary chapters, one of which is on defining the research agenda going forward, both clinically and in basic science as well. Okay. I think it has implications for shorter term therapy, but it does provide a justification for longer term therapy under appropriate circumstances.
I love cognitive therapy. I love behavioral therapy. I use it all the time. Any therapist that says they doesn't understand what they're doing, or they're terrible therapists. I don't understand. Cognitive ideas are quite fundamental to reality or behavioral ideas. However, we have this thing called cognitive behavioral therapy, which is becoming more and more prominent over time. And although I could very much argue that everything we've been talking about thus far is absolutely within cognitive therapy, schema therapy, to be specific, behavioral therapy, learning, these kinds of things. But somehow CBT has become taught to people and represents this like quote unquote pragmatic, skill-based therapy style. What do you think about all that stuff?
Well, like you, there's always, it's very, very useful techniques, and people are coming for help, and they want to feel better. They want to feel better sooner rather than later, and CBT absolutely helps with that. And there are a lot of people who don't want to dwell on the past, and even if it's going to lead to a better future. So it's not for everybody. But here's the thing. One of the things that we talk about in the book is an implication for cognitive behavioral therapy is, because we focus so much on emotions and its interaction with memory, the role of emotion is viewed differently from our perspective. So in classic CBT, developed originally for depression, emotion was the symptom of depression that you wanted to get rid of, right? And so, Aaron Beck, started this revolution where realized that if you change your thinking, it will change how you feel. And that is very well validated. Reappraisal works. If you change how you think about something, it really will change your emotional response. Okay. So the question is, how do you bring about enduring change? Because CBT, most research is short term and relapse rates are pretty high. Okay. What can you do about that? What you can do about that is adopt this memory reconsolidation perspective to view emotion not as the symptom, but as a mechanism of change. And so rather than cognition changing emotion, what about emotion changing the memory or the cognition? So as a practical example, in CBT, we often do homework, right? Well, you're going to go out and, interact socially, and you're going to try to bring about a different outcome. Well, what if what if you fail? What if, the homework isn't successful? That has emotional consequences that will probably reinforce the old pattern. Whereas if you have a good experience, a corrective experience, that will update the schema, if you will. All right. So I think that now we're talking about trying new things, having them work better, getting a reward, which is kind of instrumental conditioning. I would call that actually new learning. That's what commonly happens, right? You learn a new way of doing things and it gets reinforced. You don't necessarily change and get rid of the old memory, but you are learning a new way of doing things, and can get stronger and stronger over time. So I think that's what's going on with the modern CBTs. That's my current view. What do you think?
I agree. That's a nice way of putting it. That's not how I often, because the culture in our field, in my anecdotal experience, is one that rejects past, rejects experience, rejects long-term therapy, rejects corrective emotional experience, which is, emerged in early psychodynamic, I think in the 40s or 50s, that idea.
46.
Yes. Alexander, I believe.
And French, yes.
Yeah. And they'll say Freud's an idiot, and it's not empirically sound. And I'm like, there's plenty of evidence showing that psychotherapy and psychodynamic therapy works. And I worry for our field in this way, it becoming more and more oriented towards short-term methods, which are fine and great, and I use them all the time, but to deny and sort of make this dichotomy between CBT and everything else, I find to be silly, because like I said, I love cognitive therapy, I love behavioral therapy, and I worry about clients and I worry about trainees. A lot of people listen to this podcast who are in the field, and they'll email me and they'll say, my entire program, denounces long-term psychodynamic therapy, and I hear your podcast, and I'm like, I didn't even know any of this stuff, and it sounds more like something I want to get into. And so for students to not even be exposed to the material or to mentors that are in love with this kind of work, because I was trained in the 90s, and I feel like that was when things were kind of shifting, and I lament where our field will be in 40, 50 years. I worry. Yeah. Do you worry?
I do, sufficiently so that I'm, hoping to be able to write a book. Yeah. Hoping to write a book.
Oh, another book.
Well, yeah. Well, that would really lay out this idea. What does psychotherapy look like if we base it on Freud's dream rather than what Freud said? If we base it on neuroscience, the kinds of things that we're talking about today.
Right.
Yeah.
And of course, insurance companies don't want us talking about this because this is a lot more expensive.
It's more expensive, but if people really get a definitive alteration in their functioning, the benefits can really, really be substantial. Major psychiatric disorders, depression, anxiety, bipolar disorder, schizophrenia, they're associated with significant effects on longevity, on physical health, not to mention quality of life and productivity. The problem that we have in the United States is that health insurance and unemployment, things of that are in different pots, whereas in countries like Germany, it comes from the same pot of money. So they are willing to invest in more definitive mental health treatments for people who are disabled, and unemployed, because it gets them back on their feet, and then it saves the cost of unemployment, and it actually is cost effective to provide these treatments. We do not have a system like that where it's recognized that we have the whole person and we have to take the whole life into account.
Yeah. Side note about, I don't know how long ago, but as I was studying theory and lecturing, I think in the middle of class, one time I just suddenly said, I think corrective emotional experience is a behaviorist idea. Do you know what I mean by that?
Well, say more.
Well, because, it emerged from, deep within psychodynamic theory in the 40s, right? So, and was around corrective emotional experiences is all this psychoanalytic jargon, and it's deeply embedded in that field. And then as I learned more about behaviorism and particularly prolonged exposure, I started thinking, well, wait, like this is a corrective emotional experience. Prolonged exposure is a corrective emotional experience. Behaviorism and Freud come together because, traditionally, in the past anyway, these two fields hated each other. Well, they would never say they were in the same ballpark. And specifically, they would never say we're describing the same things,
Right. Well, a couple things to say about this. The concept of corrective emotional experience is getting wide recognition generally within the field of psychotherapy, not just psychodynamics.
Yeah.
I think another fascinating thing to note is that although Alexander and French, who introduced the concept, were psychoanalysts and intended it for psychoanalysts, psychoanalysis rejected it,
right?
Because it was, thought to be artificial and thought to be unnecessary and took away from the value of interpretation.
Right.
And in light of what I've been talking about in terms of schemas and all, and semantic memories, I have, in recent talks, introduced the idea of corrective emotional relationship with the therapist, okay, which is, I think, more acceptable to psychoanalysts than corrective emotional experience. But we're talking about the same thing, essentially. I mean, corrective emotional experience is a single episode, a single episodic experience. But the relationship is a schematic memory, and we're updating the schematic memory with an episodic experience.
Right. Yeah. Right. Which is a behaviorist idea, right, of memory.
It is.
Neuroscience.
It is.
Yeah.
That's right. And it's a very integrative idea, I think.
Yeah. Okay. Yeah. Because I would talk to psychoanalysts and they'd be like, well, come on. I mean, behaviorism, da, 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 da. I'd be like, but I don't know. It sounds like behaviorists were talking about what we're talking about. Like, I don't know if it's that. I think we can get together and agree on this.
And I think that neuroscience provides a unifying framework where we can really see
it's non-denominational.
It's non-denominational. I think the issue is that we're talking about different kinds of memory, right? Classical conditioning, instrumental learning for more of the behaviorist side, and episodic experience and schematic memories on the psychodynamic side. But I think we're talking about similar kinds of change mechanisms involving memory, emotion, interactions. And the whole range of emotional experience involves, small units of behavior versus large patterns of relationships. And, that corresponds to different kinds of memory. And so I think that neuroscience has the potential to provide this kind of unifying framework.
Mm-hmm. Yeah. Do you have to kind of break your trainees of how they've been brainwashed by our culture? Because it doesn't necessarily fall in line with what you're talking about right now.
Well, that's why I like working with psychiatry residents, because they haven't formed strong ideas about how psychotherapy works in advance.
But these ideas of pragmatism and short term and just think your feelings away, you don't have to fight against that?
Oh, no. I absolutely do. And that's actually the reason why I came up with this. I mean, I train psychiatry residents who are required to learn psychodynamic psychotherapy and CBT and supportive therapy. And in many ways, CBT and psychodynamics are very different and in opposition to one another, right? Yeah. I mean, in terms of do you get rid of the distress or do you go into it? I mean, those are fundamentally different, okay? Yeah. And so a motivation for creating this whole framework was the intuition that somehow it is all interrelated and it shouldn't be so contradictory. I drew on my neuroscience background to really put this framework forward, and I think it has value.
Yeah. Well, so tell us the name of your book again, Dr. Lane.
It's Neuroscience of Enduring Change, Implications for Psychotherapy, co-edited with Lynn Nadell, and it's Oxford University Press, and it's available from them directly or on Amazon.
Yeah. It's an edited book, so you have a lot of different authors contributing, which can really make it a a very rich experience to read a book written by, because all the different authors can really focus on each chapter instead of
They're
one
experts.
author kind of, yeah.
Each one is an expert in what they're discussing.
Yeah, yeah. Well, that's great, Dr. Lane. It was great talking with you, and I learned a lot.
Well, thank you. I learned from you as well, and I thoroughly enjoyed it. So thank you so much.
All right, everyone out there, go buy the book and take care of yourself because you deserve it. You really, really do. Hey, deserving listeners, as you all know, I am constantly recommending that people go to therapy. We all need therapy from time to time. Well, one of the options available that is definitely worth checking out is BetterHelp. If you're looking for a therapist, I would give it a try by going to betterhelp.com/Kirk. Make sure you use the promo code Kirk because you get 10% off your first month, and it really helps us out. As you watch these videos, I know many of you have been motivated to find your own therapist, which is great because you deserve it. And I know also that it can be hard to find a good fit, find the right one for you. Well, one of the options available in terms of your shopping is to go to betterhelp.com/Kirk. I've been told you can start communicating with your therapist in under 24 hours. You can message your counselor at any time. Plus, you can schedule weekly video or phone sessions. I've also been told that it's often less expensive than in-person therapy, and you should know that this service is available to clients worldwide. So go to betterhelp.com/Kirk to get 10% off your first month today.